Thank you, Speaker. My question is to the Minister of Health and Long-Term Care. Speaker, for years now, Health Science North, Sudbury's regional hospital, has been massively underfunded. Funding cuts by previous Liberal and Conservative governments have forced the hospital to claw back healthcare services available to the good people of the North. Most recently, people in my community rallied together to protect the hospital's breast cancer screening clinic. Ann Matt, who helped establish the clinic 2 decades ago, Sharon Murdoch and dozens of other women held protests and meetings. They distributed petitions and demanded that the lives of patients not be put online for cost savings. Will the minister listen to the people of Sudbury and fund our hospital properly?
Minister of Health and Long-Term Care.
Well, I thank the member very much for the question, and in fact, I'm sure, as you are aware, Health Sciences North is facing financial problems, including an $11 million deficit in 2017-18. They have been working very hard with the LHINs, however, to deal with some of those financial concerns, and we are committed to working with them and with the LHIN to making sure that they can come back to financial health. But with respect to the breast screening assessment service, I think it's important to mention that it is not closing. The LHIN has been working closely with Health Sciences North to help the hospital ensure that mammograms, diagnostic imaging services, biopsies, and navigation will all be continuing uninterrupted as they are working through their financial difficulties.
Supplementary.
Thank you, Speaker, and thank you to the Minister for her answer. I'm well aware of the budget. The budget is there because of years and years of Conservative and Liberal cuts. They need the money to make ends meet, which is why they're cutting the breast cancer program. I want to tell you about Melissa. She was diagnosed with breast cancer when she was only 32 years old. And that dedicated team of the breast cancer screening clinic responded quickly to her aggressive cancer. Later, when she developed a rare infection, the clinic helped her navigate the system and ensured she received the best care. Melissa is now cancer-free, but she's worried how those recent cuts to the clinic will impact patients. She's worried that other patients will have to wait longer to see a surgeon or go through unnecessary stress while waiting to hear a diagnosis. The cost-cutting measures Health Science North has adopted to address the long-term underfunding threaten the services that provide excellent patient care for the women in the North. Will the minister invest in our hospital and protect this life-saving program?
Thank you. Minister.
Thank you, Mr. Speaker. And through you, I would like to just correct some of the facts that have been stated by the member on the other side in the official opposition. The breast screening program is not closing. It is continuing uninterrupted because there has been careful work that is being done between Health Sciences North, the LHIN, and the ministry. We recognize that these services need to continue as they work through their financial difficulties. But that does not mean restricting patient care.
For Ottawa Centre,
what we want to do and what we were elected to do is bring more money into frontline care. After 15 years of the former Liberal government not developing a comprehensive plan, we are going to develop that plan. We are going to make sure that hospitals have the services they need, and we are going to make sure those essential patient services, such as the breast screening assessment program, continues.
Thank you.